Critical thinking, clinical judgment, and the nursing process. Critical thinking is a purposeful and a directed mental activity. Reasoning is a synonym that is often used for critical thinking. In nursing, critical thinking incorporates the scientific method and uses clinical reasoning to make reliable observations and draw sound conclusions from the patient's information. Developing critical thinking skills is a lifelong process and improves over time with experience. Clinical judgment is considered the result of critical thinking that is applied to clinical situations. There are various characteristics of a critical thinker. This individual maintains an open mind with a questioning attitude. They recognize their own biases and limitations. They are persistent to seek solutions. They can separate relevant material from irrelevant material. They can recognize inconsistencies within the data that has been gathered. They can identify missing information. They are able to consider all possibilities. They have an empathetic attitude. They use an organized and systematic approach to solving patient problems. They verify the accuracy and the reliability of the data that has been gathered. They consider all possible solutions before they make an informed decision. They can admit what they don't know. They can reason logically. They continually strive for excellence and improvement. The individual draws valid conclusions from the evidence. They set priorities and make careful, considered decisions. They are flexible, realistic, creative, humble, honest, curious, and insightful. The critical thinker will communicate effectively orally and in writing. Their thoughts are reflected on before they speak, and their information is presented in a clear and concise manner while listening attentively. Their documentation clearly conveys to other health team members what was planned, the patient's reaction to the care that was provided, and whether or not the expected outcomes were met. The critical thinker also has the ability to problem solve and make decisions, which is integral to critical thinking. This individual incorporates scientific knowledge and research into nursing, and it requires a consistent, logical method to solve problems. Using the scientific method, the individual first defines the problem, next gathers the information, then analyzes the information and develops solutions. The National Council of State Boards of Nursing has defined the practical nurse's role within the nursing process. Critical thinking, clinical reasoning, and clinical judgment are all very important to the nursing process. The nursing process is critical thinking, clinical reasoning, and clinical judgment in the language of nursing. It is an orderly way to process and assess the patient's response to current health status and to plan, implement, and evaluate the client's response to the nursing care. The nursing process is a way to communicate to all individuals what is to be done, who is doing it during each and every shift. The nursing process provides a method to make changes in the client's plan of care if the progress has not been met. It builds on the client's strengths and creates a partnership between the nurse and the client whenever possible. The goal of the nursing process is to alleviate, minimize, or prevent real or potential health problems. There are 4 distinct phases of the nursing process for the practical nurse. The practical nurse will assist with data collection. They assist the registered nurse by systematically gathering and reviewing information about the client and communicating it to the appropriate members of the healthcare team. The practical nurse will assist with planning. They will assist the registered nurse in the development of expected outcomes and interventions for the plan of care. The practical nurse will implement by providing planned nursing care to accomplish the expected outcomes. The practical nurse will evaluate. They will compare actual outcomes of the nursing care to the expected outcomes and then assist with updating the nursing care plan. A complete database includes a thorough health history, a physical assessment, a psychosocial assessment, as well as a cultural and spiritual assessment. These include both subjective or patient information, as well as objective or information that is only gathered by the nurse that includes sight, smell, touch, or sound. There are various sources of information. These will come from admission forms, a focused assessment, an interview, or a chart review. The nurse needs to review all lab and test information to identify any general concerns and to confirm the assessment findings. The nurse should note the test data that is related to the patient's current health problem that indicate any improvement or a complication. The nursing diagnosis. The practical nurse reports data collection findings to the registered nurse and assists with verifying, categorizing, and grouping patient information. The nurse also assists in analyzing the information to determine any significant relationship among the data, the patient needs, and/or the problems. The nurse will prioritize a list of patient problems. The focus for the nursing diagnosis is on actual and potential patient problems that can be addressed with independent nursing interventions. The nursing diagnoses are generalized statements that label the patient problems. The stem or the problem is linked with the etiology or the cause, and the evidence of the problem or the signs and symptoms. Nursing diagnoses focus on the patient's response to their illness or a health situation. The physician's or medical diagnoses, this is an actual health problem that the physician can treat with surgery or medications or any other form of therapy. After receiving the patient assignment, the nurse should review the chart, the computer printout, or the Cardex, whatever is used in the institution. The nurse should look up the drug information for the patient and determine what are IV solutions. The nurse should list any focused assessment. The nurse should list any procedures that will be performed. The nurse should attend report, make additional notes, and question what is not understood. The nurse will then make rounds on all of the assigned patients, because seeing the patient will alert the nurse to any changes that need immediate attention. Maslow's hierarchy of needs will help the nurse to prioritize the patients and the care that needs to be provided. Evidence-based practice research is considered to locate the best practice for the type of interventions that are appropriate for each problem statement or nursing diagnoses. Independent interventions are conducted by the nurse and does not require a provider's prescription. Interstaff communication occurs throughout the day. Staff communication must be immediate in order to communicate any urgent and relevant information that were discovered during the assessment of the patient. Urgent data is usually communicated verbally and often requires immediate action. Charting will occur on nurses' notes, treatment flow sheets, medication administration records, as well as activity flow sheets. An electronic health record is a computerized record of a patient's history and care across the facilities and admissions. The report is conducted at the change of shift according to facility policy. This will ensure continuity of care for all the patients. Any information that is retained by a student nurse for educational purposes must eliminate any identifying information. Students prepare paperwork that contains protected health information, and this must be destroyed according to the policies and the procedures of the facility. Interdisciplinary care plans are also known as collaborative, and these require input from all healthcare team members. This is developed using the interdisciplinary focus of each profession. The focus of the interdisciplinary planning is on patient problems rather than on a nursing diagnosis. This makes the language that is used in the plan common to all professions. Many interdisciplinary care plans have similar characteristics. The patient's medical diagnosis is used. Any observations are shared amongst all providers. A problem list is developed and then prioritized. A shared care plan is created. This identifies specific and shared responsibilities amongst all the healthcare providers. The plan is then discussed with the patient or their advocate. Any documentation of progress is usually on a common form or a computer record. Evaluation is always ongoing. Any interventions that have been met are deleted, or if necessary may be added and changed as needed.